Welcome to Physician Training in HealthQuest. So we'll start at the beginning where you do log in, and there will be a number of windows that pop up. At the very beginning, this PrescribeIT authentication window, you will receive a text message asking you for a verification code. This is a one-time thing each day, so at the beginning of your day you will receive a text message with that code where you enter it in, click verify, and now your communication is open to the PrescribeIT channels with the pharmacies for the whole day. The other window that usually automatically opens is going to be this security news feed. I would check this every once a week or so. You may see tips and tricks in this news feed that will allow you to speed up your workflows, or there might be some integrations that you might be interested in learning more about. So the top ones will always be the newest. So if you want to have a look, you can. Then you can close this window and you are left with your doctor view window here. This is going to be your to-do lists that has everything that you need to address. Defaults to you as the physician that's logged in. You can change this if you want to. And today's date. Obviously you can click the arrow, select a different day of the month, or you can scroll back if you want, or you can use these arrows and it will scroll through one day at a time for you. This up-to-date search, you can type something in and click go. It's going to take you to the up-to-date login page in a web browser where you can search the most up-to-date information on different diagnoses, current screening guidelines, treatment guidelines, and new medication information. This tasks is going to open up a new task window for you that is communication from yourself or a clinician to other staff members, or vice versa, that is not associated with a specific patient. This retrieve is just going to refresh this window for you. Print, same thing, it will print exactly as you see it. Close, self-explanatory. This settings toggle, if you click it, you can reorder these tabs to best suit your workflows. So if obviously you are doing PrescribeIT regularly, then you would want it further up instead of at the bottom here. But if you don't use PrescribeIT very much, you can highlight it and just simply use the arrows to move it down. You can click reset, it will take you back to the default settings. Once you're happy, you can click OK, it will apply those changes. So there's a number of different tabs here. We will skip the appointments tab momentarily, I'll come back to that one. This scans documents tab is going to be all of the faxes or scan documents that have been sent to you for review to be signed off on. So you would simply double click on it and it's going to open up a secondary window. You can review your document and you can add stamps if you wish to. You can obviously rotate. If you have reviewed your document and you need the patient to come in to discuss some results, you can click New Task here. It's going to open up your work list window and default open a new work list entry window. You can manually type in here, or you can select a template work list here so you don't have to do any typing. So if I type in this recall, it's entered my description or subject line as an email. The employee or job class need to be completed. In this case, I have receptionist because I want the receptionists to act on this one. And I want them to recall the patient for an appointment to discuss the attached results. You can add more notes in this section here if you want to, but that should be sufficient for the staff to act on this request. So you would just click save, it goes to the receptionist. You can close out of that and close out of that. Now that you've sent that task, you can click mark this as done and it will disappear from your list and move on to the next scan for you to review. And you can do the exact same again. You can scroll through them as well like this if you need to. So we'll close out of here. Now you can see that scan has gone. If you want quick access to the patient's chart, you can click on it There's also a chart button in the Scans Review window. This Lab Results tab is very similar to the scans, where you will double click, opens a secondary window. From here you can again do the same thing, create a new task, have the staff call the patient in. If you double click, you will be able to see historical values if there are any, so you can see trends over time. And if the results are red, then they are abnormal and you do need to address them. So obviously this example, you can see that it's been plotted on a graph and you can see the notes attached as well. So you could mark this as reviewed and it will disappear from your list and send you to the next patient. Just keep going through until all your labs have been reviewed. So I'm going to close out of this. You can see it's disappeared off my list. Patient messaging, this is a secure communication pathway between clinic and patient. If the patient has registered for the patient portal account, they will be able to receive messages from you guys, and depending on how your clinic is set up, they may be able to reply to a message that you send them or start a new message from scratch. So this list is all of the messages that you have either been assigned or you created. And obviously you can filter here as well as these checkboxes. I'll go into creating a new message when in a patient's chart here. The PrescribeIT tab, this is going to be that communication between you and the pharmacy. So the pharmacy can send a renewal request. All you would have to do is click on approve or deny and send it back to the pharmacy. It will then automatically update the patient's chart with the new medications. Obviously, you can then select your different statuses here. So not only can you approve and deny renewal requests, but you can send messaging back and forth as well to the pharmacist through PrescribeIT. And if you have any communication with them, obviously that is a billable service, so you can click the bill button. And it's going to open up that window where it pulls in your information as a physician, the patient's information. It defaults to this service code, which is the communication to the pharmacist. You could add anything else that you need to as well, and you would click done. Once you click done, that creates that health claim that your clinic manager or the head physician would be able to submit once a week. Work lists, this is that internal communication between clinicians and staff regarding specific patients. So for example, this one has been assigned to you. So if you double click on it, you can see that it's regarding a prescription refill to yourself, and it's got a low priority. And we have actually responded to this, so just have the patient request it electronically for you. So you would just type in your messages in this notes box. When you are ready and you need to send it back to somebody, you can then send it back to your receptionist. Leave it as pending so they know that they need to act on it. If you need to change the priority accordingly, you can. And then you would just click Save, click OK, and close this window and it disappears out of your list. Referrals is very similar to work lists, except it's specific to tracking your referrals into or out of the clinic, depending on whether you're a specialist or a GP sending out referrals. I won't go into any detail on what that looks like at this moment, but if you do want to go into further detail, you can. I will attach a link in the description to review referral management. The letters for review tab, this is going to have all the letters that you have ever created in the various different statuses. These are all the letters that Dr. Bonner has created, and they're all set to draft state. If you choose to, you can use the status to keep yourself organized in terms of whether you have started a letter but not finished it, you've finished it but you need to quickly review it, and then if you've sent it. So now we'll go back to the appointments list, and these are all your patients that are booked with you for this day. So you've got different colors here for the different patients. These are the different statuses. So this patient is in a room, and they're in room number 1. George is in room number 2. These two patients are yellow. They are arrived. They are in the waiting room, but not yet in an exam room. And your green ones are booked, but not yet here. You can also see the type of appointment that they're here for. So if it's an office visit, you can also see the reason for visit. So from here, you can open the patient's chart. You can open the client card. The client card is basically where all of the demographic information is held, which is most likely going to be your front staff taking care of all of this information. This default doc is going to be the primary provider within this clinic that is attached to this patient, and this verified checkbox will confirm all of this information to make sure it's accurate. They do need to have a PHN in order for you to bill, and if they are out of province, this client type will be out of province, and they will have a different province here with their health card number and this reg number. The notes tab is the other one that may be relevant for you. If it's something that you need all staff and physicians to see prior to touching anything with this patient, you can enter that information in this critical notes pop-up box. So you can type it in, check off pop-up, and it's going to pop up a warning message every time you open something regarding that patient. And then you can attach patients to pharmacies, to parents and children, and third-party insurance companies. Again, this is the staff that would take care of that patient portal. This will identify if the patient is attached to a patient portal account or not. And reminders. This is where they would receive their appointment reminders. And again, this is the staff that would take care of that. So I will close out of there. So as you can see, this top one here, there is a pen and paper. So if you were to left click on that, it will open up that patient's chart and open up today's chart notes. So the staff may have opened it to enter in vitals to get things started for you. But we're going to take care of George today. So if we click on chart, it's going to open up his charting window. And from here, there is a lot of information. So what we're going to do is go through an example visit with a patient, and then we'll come back and fill in the gaps here. So we're going to click on New Chart Note here, and you can select from a blank chart template here on the left. So I'm going to click on Soap Note. On the right-hand side, you can select a template that has some default text in it. So in this case, I'm going to select online booking and click OK. It's going to ask me which online booking form to pull from, so I want the most up-to-date one. And it's going to identify the reason for the patient's visit based on the information that they entered into their intake form. From here, obviously, when you first open it, the text is red. As soon as you click into that box, it changes it to black, and you can make edits to this as you see fit. You can add more text into the different fields here. These vitals boxes, if you control and left click, it's going to open historical values here as a list. If you have an actual entry in here and then you do the same, control left click, it's going to open up that graph. So you'll see the list on the right, but you'll also see your graph trending things over time. And this is the case for all of your different vitals boxes. But you can also control and left click on any field, and you'll be able to see the historical text from all of the previous plan boxes. So if the patient is here for the same thing, you could also just click on it, hit copy, and it's going to pull in that previous plan that you used before. You can then edit, type as you wish to. That's just a quick way to work through your charting. A couple of other things that can speed up creating your chart note a little bit faster is you can use auto-completes, so you can type in an abbreviation here, hit the space bar, and it's going to populate that full sentence for you. If you can't remember all of your macros that you created, you can click on this little macros box and it's going to populate all of them in a list here. Same with the objective. So if I click on the objective, if I place my cursor, these will act as phrase lists if you don't enter them as an autocomplete with your abbreviation. Place your cursor and click on it, and it's going to pull that phrase right into the box where your cursor is. Just a quick way to make your charting a little bit easier. So to create these autocompletes, you would go to Setup at the top here and Charting Setup, and down to Autocomplete Macro Setup. Click on it and you'd click on New, and you're going to type in your abbreviation. So in this abbreviation, you want to either have just an abbreviated word, or if you're going to use the full word, make sure you put your initials or a piece of punctuation at the beginning of it, just so that it doesn't actually populate the full phrase when you are typing in just the generic word. I would also limit it to you as an employee as well. And then you can type in your description here and click on Save. So then here it is. So then when you're in the chart note, all you would have to do is type in that abbreviation. So .test spacebar, and it will populate this whole test description. So we can close out of that. And to create your phrase list where you don't have an abbreviation and it's just something that you can click on, again, Setup, Charting Setup, and Phrase List. Click on New, it brings you to the bottom, and you're going to type in your phrase list here. And you can specify it to a specific chart note if you want to. You can assign it to just yourself so it won't appear on other physicians' phrase lists. And you can also sort of group it into a specific field as well. So I'll check off objective, click on Save. And then the next time you go into a patient's chart note, you will be able to see your macros. So this is a test. Autocomplete is here. So if you place your cursor where you want it, it will act as a phrase list. We also have an actual phrase list here where you just click on it and it will populate that as well for you. We do also have integrated Tally, which is an AI scribe built in that usually has an icon right here. You would click on it and it opens up a web browser for your Tally login, where you would then log in, complete your visit using Tally, where it records and will summarize your visit, and then you can copy and paste it into your chart note here. We also have Nexus AI, which will have the same concept as Tally, where you will copy and paste into your chart note. So since this patient is here for a sore throat and you've had a look and you know that it's strep throat, but you need to confirm. So we're going to do a requisition to attach to go with that swab. So you can either click the Forms tab here, or on the right hand side here on this reference panel, find your form selection here and click plus. It's going to take you to that Forms tab and open up your options for all of these different forms. So I know I need a microbiology, show all forms, and you can select whichever one is applicable. I'm going to click this most recent one. If you have templates in your clinic for your most commonly used forms, you may even have tests pre-checked off on these templates. You can then click OK. It's going to populate with your information as a physician in here, and it will populate your ID codes appropriately as well. And then you would check off the testing that you want to have done and click Save. Now you can see it as a list as in the patient's forms section. You can click print here if you wish to, but I also know that I need to give this patient some medication. So again, you can click the Meds tab, or on the right hand side you can click Add New Medication. Will take you to the Meds tab and default open your medications. So I'm going to click on Bonner's Favorites and amoxicillin here. Click OK. It populates the medication name, and I want one tab BID for 10 days. And I will click the hashtag and make sure that this quantity, unit, and quantity is filled in as well. Check off this PrescribeIT. I'm going to search for my pharmacy. If you have commonly used ones in the clinic, it will appear in the drop down here. If it is attached to the patient's client card as a favorite pharmacy, it will also default in here as well. So I'm going to click pharmacy, search pharmacy. I'm going to type in Edmonton, and you'll see the full list of pharmacies that you can select. This is just a test database, so it just has some testing sites. Obviously, you can search Shoppers or any other pharmacy that you want to find in here. You would select your pharmacy, and if this is the pharmacy the patient always uses, you can select and add as preferred. This is going to attach this to the patient's client card. So every time you create new medications moving forward, it will default to this pharmacy for you. And you would click on e-sign and send. You can now see that medication has been sent successfully, so you will click OK. And at the top here, it has moved it to an active medication and the send success. So we're going to click on back to our chart notes. From here, we know we've created a form and a medication. So in this plan, I can, from the reference panel, anything with the 6 little dots, I can drag and drop that into my chart note to save me having to type it again, and add anything else to your documentation. Then you can click on print, and it will default to today's forms and prescriptions. So if you were not using PrescribeIT, you would need to print your medication. As we sent it through PrescribeIT, we don't need to print it, so we can just uncheck it, hit print, make sure your printer obviously is the correct one. And as you can see on the right hand side here, when you click print from your charting window, you can actually print out patient handouts. So you don't need to have piles of different patient handouts just on hand in case the patient may need it. You can just attach it here, and then you can just select to print the ones that you want to as and when you need them. So I'll close out of this window. Now the all-important work. So we do need to enter in our fee codes and diagnostic codes. So you can manually type in your diagnostic code. If you have commonly used ones, then you can select from the drop-down. If you don't know what your codes are, you can double-click in the box and it will allow you to search. So I am going to do streptococcal sore throat. Click OK. It's going to populate the code as well as the actual wording. And same for the fee code. You can manually type in your code, or you can double-click and it will open up that search box for you as well. These boxes are going to be the number of calls that you make or the number of modifiers. So for example, for each extra 15 minutes, you would add how many you would have in there. So this would be your modifier codes, but I will defer to the AMA Fee Navigator website for you to identify the exact service codes that you need to be aware of and how to use them. Once you've got your codes in here, all you have to do is hit on this bill button at the top here. It's going to pull in your information as the provider, the patient's information, and all of this coded information that you added to the chart note. You can make any additional edits if you need to. These tabs are all just background information that have pulled in information to complete this claim. If you work at multiple sites, obviously you need to make sure that this location is the right one that you are seeing this patient at. And based on how you've logged in, that information will populate. You can add any notes here if you wish to under the text. And once you do that, you just click done. And here is your claim created. And that is as far as I will go for billing in this training video, as most people have a clinic manager who will submit claims for the entire clinic all at once. If you are an individual physician that submits their own claims in your clinic on your own, I will attach a link to a video in the description below to review the full Alberta Health billing process for submitting and reconciling and resubmitting from there. Just a few other details in this chart note window. You can lock it manually if you want to once you are done. Confidential, you can mark it for just your eyes, just physicians, or physicians with just your specialty. And then if you do mark it, only yourself or a system administrator can unmark that confidential flag. You can also add diagrams. So just add a blank and then you can create new, and you can mark where the pain is, for example, on here. If you open the wrong chart note template, you can change that template from here. And then obviously save, delete, printer, self-explanatory. So now that we have done a complete visit where we've created a chart note, we've created medication, we've created a form to go with our swab, and we've created a claim for this patient, we're going to go back to our overview. And if I click onto your doctor view, now you'll actually see these are all of the items that you have created for this patient today's visit. As soon as an Alberta Health claim has been created and marked, it will default this appointment to done. If you don't create a claim right away and your patient is done in the room, you can just click clear room, changes the status to left clinic, allows the front staff to know that the patient has left and that they need to clean the room for your next patient. So if we go back to our charting window, obviously you can see this is a fairly new patient. They just have a few chart notes here. So let's just go to a more seasoned patient that has some more information. Okay, so we have our chart notes here. We have our patient demographic information here, including referral doctor. Allergies, this is where you can free type in. So if you click under the allergies, it will open that up where you would fill in the applicable information. Obviously, you can see the color boxes. So for example, in this one, I have Mom Sam as for an example here. This little icon here identifies that the patient has a patient portal account. 3 overdue tasks means that there are work lists that are not complete, but their due dates have gone overdue. 1 notification pending. If you click the plus sign, it will show you what the patient is due for screening wise. This obviously is super clinic specific. They may or may not have these different notifications, but I can go into a bit more detail shortly. Netcare, if you click this, it's going to take you to the web browser to open up your login for Netcare, and then it will open up this patient within Netcare for you. View client will open up that client card. Print opens up the full chart print window. Undo, close is self-explanatory. Patient summary. This is a new provincial initiative that we have just integrated. If I click on this, it will allow you to select some of the items from this section here where you can check off, and you can actually click send this to Netcare. It will appear in the patient summary section. on their Netcare chart. So if a patient presents to Emerge and somebody is checking Netcare to review any vital information, they may see previous procedures that were not done in Alberta that the patient has informed you of. Same thing with family history. This may help you identify what the problem is with the patient. And then you can just click on send and it's going to submit that one item. So this is a manual entry that you would send as an ongoing basis, and it will update the patient summary in the Netcare. Labels is going to print you a label that you would be able to attach to either a swab done in clinic, or you can print an address label for something that you're mailing to the patient. Work lists, this opens up the work lists for this patient, which is that internal clinic communication. And letters, this will open up your list of patient letters that are attached to this chart. You can see them in the bottom corner here, that there is some historical letters down here. So if you open up the letters, it opens in a secondary window. You can see any historical ones here if you just click on them. You can create new ones here. You can select a template letter here that will default select the type based on the template as well as you as the physician. And it will automatically pull in the referral doctor that's on the client card. So if this is not correct, you can clear this out, or you can leave it and it will pull in that information. So obviously I can see Dr. Siona was the referring provider that I want to send to regarding this patient. You can fill in the gaps here. The double question marks here allow you to basically fill in the gaps to some default text that is built into your template here. So you would enter your information here and then Shift and F2 and it will tab you through all of your fill in the gap dots with those question marks to enter everything you need to. If it is a referral letter, obviously this one is, you would click Save with Ref if your clinic is using referral management, or if they're using work lists, you would click Save with Task. That will open up a brand new referral or task. Attach this letter to it so then when you send it to the staff that take care of referrals, this specific letter is attached so they know that this is the one that you are referencing when you want to send them to a general surgery. In this case, I'm just going to click on Save. If you want to add any information in this letter, for example, chart notes, sometimes your templates can be set up so that it will default always pull in your assessment box or your objective box. If you don't necessarily have everything pulled in and you want to pull something, click the chart notes. You can select which chart template you want to pull in. It will pull in the entire chart note. So you may need to delete some items if it's not pertinent to your letter. You can also pull in allergies, medications, problems, and labs here if you select the labs that you want. So obviously my lab results are right here. And once you've created that letter, I will click on Save, and I'm going to close out of it, so I'm back to my charting overview. As you can see, you've got multiple chart notes here. If you right-click, it will open a pre-existing note. If you control and right-click, it will open it in a secondary window, so you can review it while navigating the rest of the chart. If you want to open a today's visit in a secondary window, control and left click on new, select your template, and it will open it in a secondary window for you. Scan and lint documents, these are all the items that were attached to the patient's chart, reviewed by the physician if need be. So if you just right click, it will open up that document for you so you can have a look at it again. Down here you have your letters. Obviously we just went through that, creating a letter for you. Above it you have your intake forms. So these are electronic forms that the patient can fill out on their personal device, click submit, and it automatically populates into the patient's chart. So you may have an online booking intake form, you may have a patient history intake form, You may have consent forms where the patient can sign off on something, mental health screening tools that the patient can fill in. I'll open the GAD-7 just so that you can see what it looks like. Obviously, this one is just checking off the applicable sections. It will calculate for you what the scores are, and you can answer radio buttons. There are also text questions where the patient can free type their answers as well. Above it, you have your active medications. So this patient has some different medications. If you were to click on renew, you can renew selected, so it would just renew this one. If you want to renew multiple, you can control and left click to select multiple, renew selected, and it will default renew both of these. Or you can renew active and continuous. So that are those long-term medications that the patients take every day. Moving up again into the medical history, these are chart notes, but they are specifically regarding the patient's medical history as an overview. So this patient summary button up top, that is connected to some of these templates here. So if I right click on family history, I can see that my mother has diabetes, it's well controlled. So you can add other family history in here as well, free type that in. This is that information that will be available to that patient summary that you can then send up. So the procedure history is very similar with the different procedures that you could add. You could add multiple as required. The social history is just text boxes that you can type in. And we also have an ASAP template here, which is Alberta Screening and Prevention. If you control right click, have this open, you can move that over to the side. So you can have this open and reviewing it while you're in today's visit. So if you happen to be seeing this patient, but you notice that the patient is due for something because they don't have it on here, or you see a colonoscopy was not yet ordered, but yet they had a positive fit test, you can then go ahead and, even though they're here for a sore throat, you can then advise them of that positive result and you can send them for a colonoscopy referral. So you can type, if you unlock this, you can type in here, but you can also type in your chart note as well. This ASAP template will pull in lab results that have been completed and requested from this clinic that are electronically in the patient's chart. For example, the fit test here, you've got your cholesterol results in here as well. So you can close out of that. We go back to our overview here. So you've got obviously your medical history templates. You may also see a patient medical history looks similar to this. Every clinic is different and they have their own versions of these different templates. So if we click overview, this top section here, this is going to be your problems. So these are those conditions that the patient have that are ongoing. So you can click on the problems tab here. You can add a new one. You can select for the commonly used ones. If I click on new, you can also search. You can also search by diagnostic code, or you can just type in a problem manually if you would want to. I do recommend using the commonly used so that it becomes consistent throughout the clinic and it's easy for reporting purposes. So if I click on depression, I can click OK. It is down here, obviously Dr. Bonner, today's date. You can add any notes in here if you need to. You can check off confidential. If it's super important, you can check off this important. It makes it bold, just like this asthma does, as you can see in the reference panel on the right. You can see that it's bold and it will always remain at the top, even if it was the very first problem that was entered. So if I click save, I can now see that I also have depression as well. And then you can go back to your overview. So these are all the sections that are on the overview. If we go across the top here again, now we can see the different tabs within the patient's chart. We have Browse. This allows you to search based on date. So everything that you did for that date, you created chart notes and appointments, letters, medications. Obviously, chart notes will open up the most recent chart note. Medications tab. This is where you will see your medications here. So you have your drafts, your active medications, and your inactive medications. You can see the allergies here as well while you're creating your medications, so that's useful. You can click on New, create new ones. If you want to communicate with the pharmacy, select this Communications tab along the left here, click on New. It's going to default to Monique as that's whose chart we're in. You can select a medication that the patient has on file. So if I click this one, and then you would select your pharmacy that you want to send it to. Select, type your message like an email with the subject and then any messages, and you would click send, and it's going to go to that pharmacy that you selected. You can also obviously bill from here as well. Your problems, we just went through how to create a new one. You can change the status of them if you need to. So for example, say the patient is in cancer remission, you can check off resolved. Forms, these are all those requisitions that the patient has received. So you would just click on New and search accordingly. There are an awful lot of forms in the database here, so I would recommend just searching. And it will shrink your list in your blank form templates, as well as templates that you've created in the clinic. These are going to be your most commonly used forms. So obviously it is clinic specific, so you may need to check with them if you have a form that you want to add in as a template. Your lab results, obviously you've got your labs tab in your doctor view, but then obviously they are on the patient's chart as well. So you can see here that those top two have not yet been reviewed, that you can check off that review from here, and whichever one is highlighted will appear below. So that A1C, lipids, if they are red, it shows that they are abnormal. If they're black, they are usually normal unless it is coming in as a PDF. For example, a pap test comes in as a PDF document in here. Because it can't read that it's normal versus abnormal, it will appear black, so you do need to make sure that you are reviewing those results regardless of whether they're red or black in here, the description. This just gives you a quick glance for some of those other ones that do show up in red. And double click on there and you can see that trend over time as well. You can add any notes in yours regarding a lab result here. You can also click this search button here to filter through all of the lab results as they start to increase in volume on a patient's chart, just to make it easier to search for items. And then just search and cancel again to populate everything back out. And obviously you've got your referrals tab. This is what a referral looks like, that if the clinic wants to send their referral and they are managing their referrals through referral management, that would be here. And patient messaging is basically that secure messaging that you are sending from clinic to patient. If they have generated a patient portal account, if you allow them to, you can send them an invite and you can create a new conversation, enter in your subject just like you would in an email, and type in your message here. Okay, you can attach from items from the chart if you want to. I'll just show you here. It will open up this attachment window. You can attach anything from the patient's chart. You can filter by sections within the chart as well. So say with lab results here, I said it was a normal one, so I'm going to select this one, add it, click save. It will create that PDF. I'm going to click OK. Now you can see my message and my attachment, and I can hit send. So depending on how your clinic is set up, the patient may be allowed to reply to this message if the conversation remains open. If you don't want the patient to be able to respond, you mark this as closed, and it's going to confirm if you want to or not. So now you can close it. If you check this all, you'll see today's one that we just closed. This allows the patient to see the message, but they won't be able to reply to it. They will receive an email saying to log in to their patient portal account to review that patient messaging. This is a super secure communication pathway that physicians like to use, and you can also bill for this service as well. If that was the case, you can just click on New Claim, and it's going to open up that window. Obviously, you will have to manually enter in the patient information, you as a doctor, and you would fill in your service codes accordingly. Or what you could do is, because you sent a message, you can click on Overview, create a chart note. This says a blank one. It's going to open up that chart note. You can enter your service and fee codes in here and click Bill from here, and it's going to pull in that information for you with those service codes, and click on Done. So I will close that. So on the right hand side of the patient's chart here, this is the reference panel, and there are multiple different sections. So your latest lab results, your problem history, your medications, and further down here, your patient messaging. These are all items that have the 6 dots that you can drag and drop. So for example, we can drag and drop this in here. This is that patient messaging that we sent to the patient, and you could potentially drag that in to that one where you're going to create your fee codes and hit bill. So I can also put in my latest lab results, so I can drag that correct one that I'm talking about, saying that it is normal. And obviously you can see all the other items within the patient's chart. You can click on the plus sign on every one of these sections to create new items. This little settings toggle here, if you click on it, you can customize this reference panel to suit your needs. This is a user preference. So if your clinic does not use referral management, then you can click referrals and move it over to the unused section. Patient messaging you use all the time, so I'm going to move that one up here. So now I have it with my other items that I can drag into a patient's chart note. So if I click OK, now I have my 4 sections that I can drag into chart notes, visible all the time instead of having to scroll in this reference panel. So a few other items that I will make a note of here. If you are seeing a patient for WCB purposes, if they were injured at work, what you are going to do is click on New, and this could be the staff that take care of the beginning part of this. They're going to do a new chart note, click WCB Rapid Report. You're going to select which one. So the first one, you can select from a previous one, or you can open a new one. This is where you're going to fill in your employer information, where the staff may well start this for you and fill all of this relevant information in, and then go through these different sections here. The patient, what happened to the patient, the staff may enter that for you, and then you as the physician will start here, and you are going to fill this in and just follow through all of the steps, answering all the questions. And once you have done everything, you can click submit. If you have errors, it will tell you what those errors are, so you can double click on it or just click. It's going to take you to that field that needs to be filled out. And you can also print patient and doctor copies as well. And when you close out of it and you go back to a patient's chart here, I'm going to refresh the charting window and you can now see it. So if you want to go back and look at your WCB report, or if your staff have started it for you by entering all of that employee information, you will see it in that chart notes list. Right click on it, just like you would any other existing chart note, to open this window up, and you can fill in from here. So I will close out of there. This notification pending, I did touch on it super briefly. In this case, this patient is due for a mammo. So this is related to your CDS queries that are clinic specific, as well as your ASAP template here as well. So if I right click, depending on how you have them set up, if I scroll to the bottom here, the patient has no mammogram documented in their ASAP template. They are within the age range, so between 45 and 74, and they don't have a scan document that is labeled as mammogram, or in the lab reports, they don't have anything as mammogram either. So if this patient was here for a routine appointment for something else, and you see this notification pending that they're due for a mammo, you could double check NearCare to see if it was done elsewhere. If it was done elsewhere, you can add that information into your ASAP template here. Normal, and it was done just a couple weeks ago by some other physician that requested it. You can save this, update your charting window, and now that notification is gone. If they didn't have it done, you could then add your form and create a new requisition for a mammogram here. So I'm going to send to MIC, general requisition, click OK. So I'm just going to check off this one, click OK, and you can print that as well. So once the results come in, should you not have done that in the ASAP template, it would cancel out this notification. This is useful information for keeping track of routine screenings that can be completed, and depending on your clinic, you may include your staff to take care of some of these items as well. But I would recommend keeping an eye on these notifications. If there is an error, you can always call into tech support and they can help you fix those queries as well. Something else that is built into HealthQuest is this instant messaging here. So on this right-hand side here, if I close this client chart, so if you have your list of work lists that are assigned to you in your doctor view, but you also have a show work lists on the right-hand side here. If you click on it, it will have a list of all of your work lists. Obviously, you've got a cancelled and a done one, and nothing else is pending or in progress. If you have scans that are for review, again, you can see it on your doctor view, but if it's a staff member that you are sending a scan to, they would be able to click scan assigned to you to review, and you can click on it, review the report, click on done. If I close those, you obviously have referral management in here as well that will show all of those referral managements if the clinic is using it. Patient messaging here, this will show you all patient messaging for the clinic, and as I'm logged in as a physician, it will default to me as a physician. Again, you can see all of this information on your doctor view, so you may or may not use your right-hand sidebar. I'm also going to click pin, so then it's not going to keep expanding and it stays skinny. I'm going to click on this IM. This is instant messaging, which is internal communication between staff, and you can show active users only, so I don't have anyone else logged in currently. But you would just click on the staff member that you want to send a message to. type in message, running late, please advise, next patient. And then SAM test would see it. It would pop up on their messaging on their screen, and they can then send a response back if they want to. But it's quick communication that's not related to a specific patient or clinical information. It's just quick communication between staff and clinicians. There's also this send alert button here. If you click that, you can actually click on a different alert that is applicable to your situation. In a private practice as opposed to a hospital setting, some of these may or may not be applicable, but specifically it's this panic alert. If you were to click OK, it's going to pop up an instant message style window with a panic alert to everybody in your clinic that is currently logged in, and they know that they need to come to your assistance. If you can't open this instant message and then click send alert and click OK, you can click F7 and it will send that alert for you as a panic alert asking for help, basically. And only yourself or the person who created the alert or a system administrator can actually turn those alerts off. So I will close out of there for you. We still have our doctor view open, as this is basically where you will spend all of your time, because you will see when your patients are coming and going. Your scan documents and lab results are always going to be coming into you, so they will always be flowing your way. You'll see the numbers and as they come into you, so you can keep an eye on those and try and keep them as low as possible. And obviously your work lists as well as patient messaging will also appear here. So this is basically all of your different to-do lists for the various tasks that you are responsible for your day. I will quickly show you what the appointment schedule looks like for the front staff. If you click this appointments icon, this is what the front staff will be working off of, where they will have your different physicians open. You can have multiple physicians open, so they may have multiple schedules open at once. And once you are done with the patient in the room and you clear the room, you will see that it goes at murky color. That leaves the staff aware that the patient has left the room, but they need to go clean it. Once they've cleaned it, they can click the C, and they can just drag and drop that next patient into their room. And that updates onto your client doctor card as well. So this would be the clear room. Once you're done with that patient, you can clear the room, changes it to left clinic, and makes it a murky color ready for the staff to clean it again for you.